Silver Cross Hospital is a little over a 300-bed facility, but we have the lion's share of our market in southern Will County, just about 45 miles south of the Chicagoland area. And, we just have an exceptionally engaged physician community here. And I've had the pleasure and the honor of working shouldered up to our physicians for a number of years now. Our mission here is really to advance the health of the community that we serve. What we're doing is not possible without Phamily. So this is really, truly a partnership. I just happen to be in a really amazing institution. Because even though I'm in a Medicare shared savings program and we're an enhanced track APM, which is the most financially risky program that you can be in today besides direct contracting, we all operate under fee-for-service. That's how we're currently getting paid. And so when I took a step back, I said, why don't we design a program that we get paid for that actually also does the right things for the consumer? And so, the reimbursement that we're collecting today, we just want to be fiscally responsible and make sure that's covering the cost of the staff. But the end game is really, one, the outcomes, and two, that the patients are happy and engaged with us, because they will then carry, their care journey will stay with us over their continuum of their life. So that's really why CCM was important, because the activity that's getting done within the physician practice on a day-to-day basis is not captured or not reimbursable, but that time is critical to preventing adverse events. I've seen some other clients try it with, or some other providers try it with other EMRs, but I was actually just in a physician practice last week, and they were telling me they sort of hit that 500 threshold, and they have 2 staff members, and they just feel like they can't do any more. And so when you think about, most physicians today have active panels of at least 2,500 to 3,000 patients. How do you deliver personalized care to 3,000 people every day, all the time, on an ongoing basis? Is really impossible. And with the shortage of primary care physicians, you've got all these different models out there, and they all do great things. Direct primary care and, fully capitated models like ChenMed and Iora, and those are all great, and they serve a purpose. Where I'm at, where we're at in our space, is we need to build a program that can live within the fee-for-service environment, because that's where we are at our point in our journey. And it's just really kind of led me to kind of help the physicians understand that the medical model versus the chronic care model, and we need a partnership, right? So I'm surrounding the patient, I'm surrounding the provider with additional resources, and our team is getting reimbursed by Medicare to spend 20 minutes with that patient, whether that's connecting them to, addiction specialists, connecting them to community services. We had a patient that's so arthritic, and we had a huge snowstorm in February, and she couldn't shovel her driveway to get out to the grocery store. So we were able to tap into a community resource that came over and shoveled her sidewalk. We had a patient that, seemingly was doing fine. We did a check-in around medication adherence, and he was able to disclose to the care manager that he was prescribed a medication that he really can't afford. And he was too embarrassed to say anything to his physician. So I think that's another critical thing for people on the line to understand is, I was completely shocked at what people were willing to disclose over a text message. And I think maybe that little bit of anonymity, that it is a text message. You do have a relationship with this person, though, that they're sharing, that there's really struggles going on in their lives, and how can we step in and help intervene. That was a quick message sent to the provider through the EMR. The medication was changed, the new med was sent over, the patient's still adherent. So I think those are the kinds of things that I want people to hear, that you just don't really know what's going to pop up. Today they can afford the medication, tomorrow they can't. And because we do these micro check-ins with our patients on a weekly basis, we're finding out when those events are affecting their lives, and then we're able to intervene in those quickly. I think other people just generally had a sense that Medicare patients would be adverse to technology, and I thought the complete opposite. I have a Medicare-aged parents, and they text. They have no difficulty with that whatsoever. Introduce a portal, introduce an app, I think you have a different story. But that's the beauty of working with Phamily, is because the text messaging is so easy for them to use, that we didn't really find any barriers there. Everything is really captured in the day-to-day activity with the patients via the texting platform. So that allows us to record the time that we spend with patients very easily. And then it doesn't become an additional administrative burden on our team to sort of record that time. For me, this is really how we're going to move into the future of having these small micro interactions with our patients and our consumers on a regular basis. And the minute that need comes up, our team is able to intervene and address and put them into the right site, right place, right care, right time. I think, we're now seeing operating margins over 30%, highlighting the partnership between us and Phamily. The way that I structure this team is they're not medical assistants in a clinic doing this part-time. We hired a team of people that have, and these MAs and nurses have well over 10 years experience doing preventative and population health type of work. I'm really proud, honestly, that we have a vehicle for clinical professionals to work from home. To be frank, I think people are looking for something different, and I had zero issues hiring for these positions. I had multiple applicants every time I posted a position, and I probably have 10 or 15 more for the next time we're ready to grow again. And the clinical folks love this.